All right, let's jump right into this explainer and take a macro tour of one of the absolute most fascinating structures in the human body, the spinal cord. It is literally the central superhighway of your nervous system. And today, we're going to explore its extent, its structural boundaries, and the general features that basically make human movement and sensation possible. You know, it's a massive paradox when you stop and think about it. How does something so physically small act as the central information conduit for your entire body? We usually picture the nervous system as this sprawling, massive network. And yeah, that's totally true for the peripheral nerves. But the core processing and transmission line, the main trunk of the tree, so to speak, it is shockingly compact. To put that into perspective, this master cable of the central nervous system weighs a mere 30 grams. I mean, that is roughly the weight of a standard light bulb. In an adult male, it measures about 45 centimeters in length and roughly 42 centimeters in an adult female. So we're talking about just a foot and a half of delicate tissue carrying virtually every single command from your brain down to your body and every sensation from your body right back up to your brain.
Here is our roadmap for today. 1. Meet the spinal cord. 2. Growth and positional changes. 3. Protective armor, the meninges. 4. Surface features and segments. And finally, 5. Enlargements and cauda equina. Okay, Section 1, Meet the spinal cord. Let's go ahead and set our geographical boundaries. The spinal cord is essentially a long, slightly flattened cylinder making up the lower part of your central nervous system. It starts exactly where your brainstem ends, specifically at the medulla oblongata, right there at the base of your skull. But catch this. It doesn't go all the way down. It actually only occupies the upper 2/3 of your vertebral canal. Functionally, it is an absolute marvel. It acts as this vital two-way transmission line between your brain and body, and it can even execute simple reflexes entirely on its own without even waiting for the brain's permission. Pretty wild, right? Moving on to Section 2, Growth and Positional Changes. What's really fascinating here is that the cord's position inside your back actually shifts as you grow. This happens because your bones grow way faster than your nervous tissue. Up to your 3rd month of development in the womb, the spinal cord extends the entire length of the vertebral canal. But as you develop, the vertebral column outpaces the cord, so the cord's endpoint gets drawn upward. By the time you're born, it ends at the L3 vertebra, and by adulthood, it terminates even higher, usually right at the lower border of the first lumbar vertebra, or L1. All right, Section 3, Protective Armor, the meninges. Given its absolutely crucial importance, this delicate 30-gram cable requires some serious protection to survive the bending, twisting, and impacts of our daily lives. It's wrapped in 3 distinct protective membranes, known as the spinal meninges. From the outside in, first you have the dura mater, which is a tough, durable outer sheath. Beneath that is the web-like arachnoid mater. And finally, intimately hugging the cord itself, is the pia mater. These layers, combined with a literal bath of cerebrospinal fluid, create an incredibly effective shock-absorbing system. So what's the real-world application here? Well, this anatomy actually dictates modern medical procedures. Because we just learned that the adult spinal cord ends at the L1 vertebra, physicians know exactly where they can safely access the vertebral canal. If they need to perform a lumbar puncture to draw cerebral spinal fluid for testing, they absolutely must insert the needle below L1. The safest, most preferred insertion site is actually the posterior space between the L3 and L4 vertebrae. At this level, there's no solid spinal cord left to puncture, so you completely avoid mechanical injury to the cord itself. Which brings us to Section 4, Surface Features and Segments. Just like the vertebral column, the spinal cord is segmented, giving rise to 31 pairs of spinal nerves. But remember our timeline from earlier? Because the cord is shorter than the spine, these 31 spinal segments do not line up perfectly with their corresponding vertebrae. They actually lie above them. For instance, your lower cervical segments sit about 1 vertebra higher than their corresponding bones, while your lumbar segments are found way up opposite the T10 and T11 thoracic vertebrae. This is a massive rule of thumb for diagnosing spinal injuries, because damage to a specific bone will end up affecting a totally different spinal segment. Now, looking directly at the cord's surface, it's divided into 2 symmetrical halves. The front, or anterior aspect, features a deep, distinct groove called the anterior median fissure. This is super important because it houses the anterior spinal artery running the whole length of the cord. The back, or posterior aspect, has a much fainter groove called the posterior median sulcus. It's through these tiny lateral grooves on the surface that motor and sensory nerve rootlets actually emerge and enter the cord. And finally, Section 5, enlargements in cauda equine. So the spinal cord isn't just some uniform cylinder. It physically adapts to its workload, creating these specialized traffic hubs. There are two distinct spindle-shaped swellings, the cervical and lumbar enlargements. These areas are visibly sicker because they pack a massive number of large motor neurons. The cervical enlargement houses the heavy neural machinery required to power the really complex muscles of your upper limbs and shoulders, while the lumbar enlargement down below does the exact same heavy lifting for your lower limbs and pelvis. This leads us to one of the most visually striking features of the entire nervous system. Because the solid cord ends early at the L1 vertebra, but those lower spinal nerves still need to exit through their respective lower intervertebral foramina, they have to travel down a long way inside the canal. These nerve roots basically cascade downwards in a bundle from the end of the cord, forming this beautiful, sweeping structure literally named the cauda equina, which is Latin for horse's tail. Understanding this anatomy is absolutely critical. If something goes wrong in this lower space, let's say an extradural tumor or a severely prolapsed disc compresses these specific cascading roots, it causes a severe medical emergency known as cauda equina syndrome. This syndrome is characterized by some really alarming symptoms. We're talking areflexic paralysis, meaning a loss of muscle function accompanied by an absence of reflexes in the lower limbs, a distinct saddle-shaped area of numbness, severe root pain, and eventually urinary and bowel retention. It perfectly illustrates exactly why knowing the layout of these nerves is so essential. We've seen how this 30-gram, 45-centimeter cable is expertly packaged, cleverly positioned, and strategically enlarged to govern our every move and sensation. It is a true marvel of biological engineering. But this macro tour is only half the story. If a tiny cable can do all of this from the outside, what microscopic wonders and cellular networks are firing in the gray and white matter hiding inside? Well, that is a secret for our next explainer. Thanks for joining me, and keep exploring.